cardiac MRIs are a useful tool that can be used for certain specific patients. If we think someone may have cardiomyopathy or an infiltrative disease, which is basically an abnormal thickness of the heart, we have cardiac MRI that allows us to look at that. Also, there's other diseases of the aorta and the blood vessels that can allow us to assess very, very closely with a cardiac MRI to assess if you have any significant heart disease.